Good evening, everyone, and thank you for joining me. My name is Karen Vikos, and I'm a dental hygienist in the Chicago area. I've been practicing full-time for the past 13 years, and about 6 years ago, I started using Acteon technology, and I noticed I effectively decreased my patient chair time, increased patient satisfaction, I increased patient treatment acceptance while decreasing my hand fatigue. I quickly became a huge fan of all things Acteon, and that is due to the quality of their products. In 2018, I became a consultant clinical trainer to Acteon, and since then, I have enjoyed sharing my clinical knowledge and educating dental device end users. Tonight, I'm going to share how I incorporate my technology workflow and trends to provide a minimally invasive prophylaxis. As stated, I'm not employed by Acteon, and I'm an independent consultant. I have accepted an honorarium from Acteon this evening for tonight's presentation. All of my opinions expressed are based on my own clinical experiences and not those of Acteon. I'd like to start by thanking Acteon for sponsoring this webinar. Acteon Group is a French medtech company, and they specialize in high-tech dental and dental medical devices. Acteon is the world leader in intraoral camera patented technology, and Acteon has the most sophisticated piezoelectric system on the market. In addition, Acteon offers an outstanding product line of dental devices, digital imaging, and hand instruments, and I encourage you to visit their website for more information. Tonight, I'm going to be discussing understanding a prophylaxis appointment workflow, benefits of incorporating a prophylaxis technology workflow, how I utilize an intraoral camera, a piezoelectric ultrasonic scaler, manual instruments, air polishing, and then we're going to summarize and have some time for some questions, followed by your continuing education quiz. So let's get started. Understanding a prophylaxis appointment workflow. So over the past year, I like to send out online polls to hygienists across the country because I like to see where they are and what they're doing and how I am compared to what others in the nation are doing. So the first survey question I posed was, how many minutes do you get to complete an adult prophy? I had 600 respondents, and 74% said that they take 60 minutes to complete a prophy. I also utilize 60 minutes. So for tonight's presentation, it's going to be based on a 60-minute appointment time. This is my established average adult prophylaxis appointment workflow. After I greet my patient, I establish the visit and ask the patient if they have any dental concerns. I review their medical history. I also do their intraoral, extraoral exam. I'm going to examine and clean any of their oral appliances, and I'm going to complete their necessary radiographs. I like to have all of that information so I can determine what the best method is to complete a prophy. And that takes me approximately 7 to 10 minutes. So I'm about 10 minutes into my prophylaxis workflow at this time. After that, I'm going to start my prophylaxis treatment, and I like to start by taking some pre-prophy intraoral photos. Then I'm going to move on to ultrasonic instrumentation, hand instrumentation, air polishing. Also, I might take some post-prophylaxis intraoral photos, and I'm going to floss my patient's teeth. And that takes approximately 20 to 22 minutes. So I should be about 30 minutes into my appointment time. Afterward, I'm going to update their perio chart, discuss their perio health. I'm going to review their intraoral photos, discuss their patient education, discuss potential treatment, review their treatment plan, recommend any adjunctive services, and I'm also going to assist my doctor with the POE and complete any necessary referrals. That's going to take me approximately 12 to 15 minutes, so I should be at the 45-minute mark. The remainder of my appointments, I'm going to be completing the adjunctive treatment. I'm going to post the treatment, do any scheduling that's necessary. I'm going to dismiss my patient, complete chart notes. I'm going to clean my operatory and process any instruments, and that takes me approximately 10 minutes. So I should have a few minutes left over in my appointment time. And I have found that I am more efficient when I complete my prophylaxis appointment workflow in this manner. So what are some of the benefits of being efficient? Benefits of an efficient workflow. You're going to have time management. You're also going to have increased patient satisfaction, and you're also going to have time to do proper patient education. You're also going to have an increase in treatment acceptance. So how can we become more efficient and effective while providing minimally invasive treatment? I found that I am more efficient and effective by incorporating a prophylaxis technology workflow. The prophylaxis technology workflow that I prefer utilizes Acteon technology, and I prefer to complete my prophylaxis technology workflow near the beginning of my appointment time. When I start my prophylaxis technology workflow, I like to start with my intraoral camera. So my second survey question was, do you use an intraoral camera frequently? 500 hygienists responded, 77% said yes, and that's wonderful. The intraoral camera that I prefer to use is Acteon SoPro Care camera. This is a fixed focus camera, and this is the only intraoral camera on the market that offers this patented technology of fluorescence and selective chromatic amplification. And that's necessary for this camera to have 3 modes of operation. There's a daylight mode, a caries detection mode, and also a perio mode. This camera also has a SoPro touch, and that's a very sensitive touch feature. It's similar to using your finger when you're swiping on a touch screen, and that's going to instantly capture the image that you want to acquire. It has a focal ring with 4 preset selections for portrait, smile, diagnostic, and macro vision. So let's take a closer look at these selections. So the focal ring's located near the center of the camera, and these selections are programmed to provide the proper distance from the subject for the most optimum image quality. The first setting is in the portrait mode. The second setting is used if you want to take those smile images, if you're doing whitening or initial photos for a new patient. Also, if you want to photograph an arch. And I also like to be in this setting if I'm taking any photos of any oral lesions. The third mode is the diagnostic mode, and that's where I spend the most of my time because that's where I'm taking my single tooth images, and that's where I'm able to change between those 3 modes of operation. The fourth mode is called macro vision, and this is really exceptional. Not a lot of cameras have this. What this feature is if you suspect that a tooth may have a micro crack, when you lay the camera right on the tooth surface, it's going to magnify the image up to 115 times. And the photo above the tooth is just a picture of fabric, and that's there to show you the detail that this camera is capable of capturing. As mentioned, there's 3 modes of operating. There's a daylight mode, a caries detection mode, and also this perio mode. And if you notice in these images, in the bottom right-hand corner, there's a colored square, and that's for the clinician to know where they are and what mode they're using with the camera. So let's take a closer look. And the daylight mode is where you want to be to get that true color image quality. This is what mode you're going to be on when you're taking the patient's portrait. Also a single tooth, the quadrant, the arch, the smile images, or the macro vision. And here's some examples of the camera used in daylight mode. You can see how beautiful these images look. If you look at the arch in the upper left corner or the occlusion in the center top, you can just see the detail and the quality that this camera is capable of taking. The next mode is the caries detection mode, and this highlights caries and incipient lesions. And if there is any caries or incipient lesion, it's going to appear red on the monitor. And I want you to look at this tooth in this image. If you notice, there's a lot of saliva on the occlusal surface, and that's an indicator for you to know that this camera can actually be used in a wet and dry field. To activate the caries detection, you want to press the button on the bottom towards the bottom of the camera. And this mode uses fluorescence, and that makes it possible to detect decay even in its earliest stages. This is going to result in minimally invasive treatment for the patient. And you can see in these images where the red is illuminated in these distal pits and fissures of the teeth and also on the buccal surface. This is a great tool for patient education and also for guiding your doctor when he's coming in to do his exam. He's able to see clearly where he can focus more on the patient's tooth. The next mode is the perio mode, and this is used to highlight gingival inflammation and plaque. And gingival inflammation is going to be in shades and hues of pink to magenta. Plaque is going to have this grainy white appearance, and calculus is going to be hues of yellow to dark orange, depending on the age of the calculus. So here's some examples in the perio mode. And the way we activate the camera is by pressing the top button on the camera. And this mode uses a selective chromatic amplification, and that's going to differentiate the color of the tissue and reveal oral hygiene pathologies. And you can see by having this, it's going to rapidly assess the patient's oral health without adding any disclosing solution. You're going to be able to identify early pathologies, and that's going to result in early intervention, and again, that minimally invasive treatment. You're going to be able to educate the patient better on their oral hygiene, and that's going to help them maintain the health and longevity of their dentition. Applications of using a camera prior to a prophylaxis that I prefer to use, and this can be used for any type of camera. I like to take photos of any tooth that may have caries, and then I'm able to see the image more clearly. Also, I want to look at any soft and hard tissue conditions. I want to see if the patient has any attrition, abfractions, gingivitis, recession. I want to take photos of those and keep them in the patient's chart for future reference. I'm also going to look for abnormal oral lesions. This is extremely important to have on file. This is going to be used if the patient has to come back for a follow-up, or if you're going to be referring the patient out of your practice to a specialist. You want to be able to send as much information as you can on the patient. I also like to take photos of the hygiene presentation. So if the patient has any calc, plaque, or staining anywhere on the teeth where I think they need to improve in their hygiene, I'm going to photograph that as well. And this is all prior to the prophylaxis treatment. After I complete the prophylaxis treatment, I may need to take some more photos. Photos I like to take are of existing treatment. You may have a patient that has an old amalgam filling with open margins or distal cracks on it. You may not have seen that in the initial view of the mouth because it may have been covered by plaque. So after the prophylaxis, as I'm cleaning the patient's teeth, I'm looking to see if there's any teeth that I want to talk to the patient about, and also my doctor. So I'm going to photograph any existing treatment. I'm also going to be looking for potential treatment when I'm doing my prophylaxis. So I'm going to photograph anything at the end of the appointment that I may have missed prior to starting the prophylaxis. I'm also going to then take my hygiene presentation photos to show my before and after. The photo in the last slide was like the one on the bottom here, and now on the top you can see how much cleaner the tooth is, and I'm going to share that with the patient. So this is me in my operatory, and on the left, I want you to see how I'm standing, holding my SoProCare camera in my patient's mouth, and I'm looking at my monitor on my computer screen as I'm going around the patient's mouth. So I did a short video for a demonstration, just so you can see how I'm utilizing my camera. So as I hold the camera, I'm just using a light grasp. I'm holding it like a wand, and I'm in this image here, I'm actually using my thumb, and I'm switching between modes. So I'm going between the caries detection, which is blue. I'm switching into the perio mode, and I'm also in the daylight mode. And any photos that I think need to be shown to the patient or my doctor, I'm capturing those images. When I switch to the mandibular region, I'm going to turn my hands on that. Then I'm going to use my middle finger and my ring finger to control the modes. And I'm still switching back and forth easily. You can see I'm going between the caries detection, which is the blue, the perio mode, and then also the daylight mode. Typically, when I do this it takes me just right around 45 seconds. Because I was doing this for a demonstration for this presentation tonight, I just spent a little bit more time, but typically right around 45 seconds to complete this. So here's a case presentation of 18 buccal. This patient came in and they had a lot of plaque and calculus on the buccal surface of 18. So I wanted to take an image of it. I then took an image of it in the perio mode, and I want to showcase here the saliva on the occlusal surface. And the reason why I bring this up is I want you to see that these images were rapidly captured in sequence. There was no delay in taking these images. I went right from the daylight mode, captured the image, perio mode, captured the image. So after I was done with my prophylaxis, I retook the photos again. And now when I presented this to the patient at the end of the appointment, I wanted them to see the difference. The daylight mode does take beautiful pictures, but look at how much more dramatic it was in the perio mode. The perio mode was much easier for the patient to comprehend and understand where they need to improve on their own oral hygiene. Camera accessories and uses. So regardless of what brand of intraoral camera you are using, you should use the barriers recommended by the manufacturer, and using the proper barrier sheath is going to provide the best image quality. Now, Acteon does manufacture their own, but they also manufacture these SoPro tips, and these tips are placed over the camera lens. And what's great about these is that they actually block out ambient light streaming in. So I'm going to get a better picture quality when I have that on near my camera lens. It's made of silicone, so it's autoclavable, and it also helps prevent the camera from slipping if it's placed on a tooth. And for best images, again, whatever camera you're using, I always recommend dry the tooth or the teeth, whatever it is you want to image. I also like to balance the camera on the opposing tooth and arch. Since I'm always looking at my monitor when I'm utilizing my camera, when I'm balancing on the opposing arch, it helps me stay oriented in the patient's mouth, and it also provides stability. And if you need to take an image of someone's tooth where you need to get the mesial and distal aspect of the tooth, just have the patient open and close their mouth, because you're still going to get that stability and you're still oriented. So after I'm done utilizing my intraoral camera, I like to then use my ultrasonic instrumentation. My preference is to use piezo. So my survey question number 3 was, on average, how many minutes do you spend using an ultrasonic on a patient during an adult prophy? Now, any hygienist who may be on this webinar this evening, I encourage you to time yourself so you can see where you are compared to other hygienists in the country when they answered this question. So 300 hygienists responded, and 2/3 said that they spend 6 to 10 minutes using an ultrasonic on the average adult patient. And I agree. I am between 9 and 11 minutes when I use my ultrasonic. As a clinical trainer, I'm often asked, what is the difference between piezo and magneto? So magnetostrictive, that's what I was taught in school. When I went to dental hygiene school, my program only taught magnetostrictive. So when I came out, I had extensive experience using magnetostrictive for about 6 years, but I found that it was very limiting for the applications that I was seeking more assistance with. And that's when I researched piezoelectric, which led me to Acteon. So I want to show you some key differences between piezoelectric and magnetostrictive, and this is regardless of manufacturer. Piezoelectric utilize tips that are very similar to hand instruments, and magnetostrictives use inserts. So typically piezos have about 80 different tip styles, and magnetos have about 9 different insert styles. Piezos can be used for hygiene and perio, endo, and also restorative treatments. And magnetostrictive is primarily used now in hygiene and perio. Piezos use a linear tip motion, so that moves back and forth. Think of like a windshield wiper. And magnetostrictive use an elliptical tip motion, and that's in a circular motion. That's a very strong key difference. Piezos are activated by crystals in ceramic discs, and those are located in the handpiece. Magnetostrictive, those are activated by metal stacks, and that's part of the insert. And I bring this up because more water is needed for a magnetostrictive because those metal stacks are generating more heat than the crystals in ceramic discs. When I'm using my piezoelectric ultrasonic scaler, I never have to stop during any treatment because my handpiece gets hot. A handpiece on a piezoelectric will never get hot. You never have to stop and refill with the barrel with any type of water. There isn't a barrel with a piezo, and it's going to maintain the same temperature throughout the entire appointment. So this is the piezo ultrasonic that I use. It's Acteon's Neutron P5XS, and this has a continuous frequency with consistent performance. That's true for all of Acteon's ultrasonics. And what that means is when I'm using my ultrasonic and the patient has very tenacious, heavy supra and sub calculus, My instrumentation that I'm using with this piezo, the handpiece is going to have this consistent performance. It's similar to four-wheel drive. So I don't have to use or exert any force with my hand. There's no pinch force, there's no pressure. The handpiece does all of the work to remove the bulk of all of that calculus off of the patient's tooth. So I'm just using a light pen grasp when I hold this handpiece. Other features why I love this so much is that it has this independent water tank. So there's no water line. I control the water temperature, and I can add any medicaments that I choose into my water tank. And the Acteon units have a one-way peristaltic pump. So what that means is there's no valves. So I don't have to worry about cross-contamination or any backflow. That will never occur with a peristaltic pump. I have a water control. I also have this glass-plated dial, and that's where I'm going to control the power. And there's 4 different power modes. It has a BLED handpiece, and it has a great ergonomic design, and it's also autoclavable. So let's take a closer look at this handpiece. The handpiece offers this extra comfort when holding it, so it's going to decrease your hand fatigue, but it also conserves tactile sensitivity. So it's very similar to hand instruments. Like I said, the strokes that you're using when you're utilizing a piezo is very similar to hand instrument strokes. And this unit allows for the tactile sense to be conserved, and you're only using that light pen grasp. It has illumination at the working end, and that's going to increase your visibility. It's going to make you more efficient. The more efficient you are, the more minimally invasive the procedure is going to be for the patient. They also have removable tips, and there's 27 different types for hygiene. So let's discuss the piezo tip selection. Many manufacturers offer very similar styled piezo tips, but I'm going to show you the ones from Acteon because those are the ones that I use most often. Now, Acteon does offer a wide variety of tips depending on applications that you're going to be using. I typically use 3 different tips throughout my day. Those are my preference, but it's nice to know that there is a variety for different applications if I need them. I am going to make a recommendation. Regardless of whatever ultrasonic that you're using, either piezo or magneto, I do recommend record the tip that you use in the patient's chart for future quick reference. The patient may see a different hygienist at the next appointment, and it's nice to be able to have that reference so you know what worked best on your patient. So you know if it was something that the patient preferred for comfort, or you know if it's a tip that you use because the patient had more calculus and you knew what tip to use for the best removal. So let's take a closer look at some of the popular piezo tips. This one is called the 1S scalar tip, and this is a universal tip. It's designed very similar to a magneto tip, and this is used on low to high power, and it's for supra and subgingival scaling. It's great for interproximal areas, and it's going to remove that tenacious calculus. This tip is called the H3 perio tip, and it's very similar to an anterior universal curette. This tip is used on a lower power setting, and due to the way the tip is designed, less aerosol is observed when the tip is activated, and that's due to the curvature. So this only utilizes minimal water. I can tell you that after we came back after the pandemic from the quarantine, this tip was by far superior with the concerns of having reduced aerosol. I was able to use this tip and still use my ultrasonic after coming out of quarantine. The 10Z scalar tip, this is the universal tip. It can be used on low to high power, and it has multiple purposes. If you notice the tip, it's actually designed like a probe, and that's because it is one. It's the same thickness of an average probe, and it has these laser cut markings in 3mm increments. So to utilize it as a probe, all you have to do is deactivate the instrument, don't step on your pedal, and then to activate it, step on your pedal, and then use it as a subgingival scaler. You can also use it for irrigation. So for that patient who may be in perio maintenance and you have to do periodontal probings, I can probe, scale, and irrigate, all without using a different instrument in the patient's mouth. I also like to use this if I'm irrigating fixed appliances, like a bridge or someone who may have an all-on-4. Acteon designed these implant protect tips that are phenomenal. They're made out of pure titanium, and the kit comes with a universal and a right and left angle. And there's 2 different size choices, and that's dependent on what type of implant thread you're going to be using. The tips are long with thin shanks, and they're used on low power with a low water setting. And regardless of what ultrasonic you're using, either piezo or magneto, I encourage you to check your tips with the wear guide weekly. Every manufacturer should have some type of wear guide that you can use for your tips or inserts. So what you want to do, like I have done in the center photo here, you want to align your tip up to the card, and there's a red line, and the tip should not be worn past this red line. That marker indicates that if the tip is worn beyond that red line, that it's not functioning properly. That's showing you that there's a 2 millimeter tip loss, and that's going to be an automatic 50% decrease in function, and it's going to increase your time, and it's also going to increase aerosol and also noise. I'm able to audibly hear if my tip is getting worn by the sound that it's making. And you also don't want to turn up the dial on your unit, whether it's piezo or magneto. I have heard some hygienists say, oh, if the tip is worn, just turn up the dial. That is absolutely contraindicated. You should not be using any tip that is worn beyond the 2 millimeter mark. So my unit has this lighted dial, and it has 4 modes. It has 2 for hygiene and 2 for restorative. And I wanted to show you that these tips have these colored markers on it, and that's an indication of where you need to be on the dial. So the blue in the blue mode, and the green in the green mode. And if you are using Acteon technology, just know that you can always turn the power setting down, but you don't want to turn the power setting greater than where you should be on the dial. So this green tip, the periodontic tip, you never want to be in a zone higher than the green mode. I want to take a moment to discuss frequency and amplitude, because I think everybody should really understand the technology that they're using when they're using ultrasonics on a patient. Because the better you understand your instrumentation, the better you're going to be as a clinician, and the better treatment you're going to provide to your patient. So frequency is controlled internally, and that's set by the manufacturer. And that's how frequently the tip moves back and forth in 1 second. That is not something that clinicians can control. What clinicians can control is amplitude, and that's the power. And we control that by moving the dial or the power setting on our units. The reason why amplitude is so important is because that's what's going to control the distance or length of the tip movement. When you have an understanding of how your unit works, you're going to be able to provide better comfort with your patient. And you should always start by using the lowest power setting. So you want to think in terms of lower the power setting, is lower the vibrations, it's going to be lower aerosol production, but it's also going to increase your patient comfort. And I always encourage everyone, for every single tip that you use, please calibrate your tips. By calibration, I mean when you insert your magneto insert or utilize your piezo tip, you want to make sure that the tip has a mist and a drip prior to putting it in the patient's mouth. You don't want to be on the same setting for every single tip all day long, because 9 times out of 10, every tip is off slightly. So you just want to make sure you're doing the proper thing for your patient. HVE reduces aerosols more than 90%. So back in 2004, Baylor University in Texas, 2 doctors named Harrell and Molinari, they conducted a study, and it was called Aerosols and Splatter in Dentistry. And they determined that to minimize the reduction of airborne contamination to the lowest level, there was 4 layers of defense. And those 4 layers are proper PPE, mask, gloves, and glasses, routine use of an antiseptic pre-procedural rinse. For the study, they used chlorhexidine, and also routine use of high volume evacuation when using any device generating aerosol. They also stated that the use of HEPA filtration and UV light ventilation system was also optimum to have this reduction in airborne contamination. So at the end of their study, they stated that the use of HVE, high volume evacuation, has been shown to reduce the contamination arising from the operative site by more than 90%. So after coming out of quarantine, I made a video, and the video shows me using my piezo, high volume evacuation, and a mouth mirror. So I've been utilizing single-handed hygiene. In my operatory, I also have HEPA filtration and UV light And I also have a floor unit as well. But this is how I hold my hand instrumentation, my ultrasonic, when I'm using an HVE. And I wanted to share this with you. When I clean the lower anterior lingual, I like to place the HVE just off to the side of the mouth mirror. This way I have clear indirect vision. And the HVE is capturing all the aerosol. You can see that there's no splatter on the mirror. Also, look at the patient's lip. The lip still remains dry. When needed, I'll switch to low volume. For the saliva and water pooling. So after I'm finished using my ultrasonic, I'm going to use some hand instruments if necessary. Survey question number 4. On average, how many minutes do you spend hand scaling a patient during an adult prophy? 1,100 hygienists responded. 54% said that they used 16 to 20 minutes. And I have to tell you, I was very shocked by this number. I thought that was very excessive, especially if they're utilizing ultrasonics. When I use hand instrumentation on a patient, I average between 8 and 10 minutes. So having 16 to 20 minutes to do hand scaling leads me to believe that either their ultrasonic tips are not functioning properly or they're using dull or inefficient hand instruments. So earlier this year, Acteon launched a new product line of hand instruments, and they called them Bliss. And I was fortunate to be a part of their focus group. And I also worked with the product development team for the past 2 years. And I have to tell you, Acteon did conduct a lot of research to produce these exceptional hand instruments for our benefit. So I like to share with you their handle design. So some of the benefits of the handle is that it's a very lightweight. It's 15 grams, and that's equivalent to 2.5 quarters. It has this silicone grip, so it's not going to slip. So regardless to what moisture is on my glove, my hand instrument is not going anywhere. And Acteon designed this with these auto stops built in. So as I'm holding my instrument and I'm rolling it between my thumb and my index finger for proper adaptation, these stops, these auto stops that they have, it's going to provide leverage for me, and it's also going to reduce pinch force. These instruments are also color-coded by category, and they're very smooth to reduce debris collection. So they have this simple color-coded instruments, and all the diagnostics are blue, and the scalers are categorized by family. So the sickles are green, Gracies are purple, the universals are red, and they took the best of anterior sickles and paired them with universal curettes, and they came up with these combo instruments. And what's great about having color-coded instruments, and this is true for all manufacturers of instruments, when the instruments are color-coded, that's going to increase your efficiency because you don't have to think twice when you're looking for your instrument on a tray. I know that when I'm going to grab my H67 that it's green, that I can just quickly identify it and pick it up. I'm not picking up several different instruments. By having a color-coded system, it makes me more efficient. Of all the instruments that they designed, I want to take a moment to talk to you about the M23. This is my favorite scalar instrument, and I was excited when I received it because I was not familiar with using an M23. So I want to talk to you about it for just a moment. This instrument is very popular in Europe, and it's very similar to the 204 SL. But what I like about this particular instrument is that it has this enhanced comfort. It has that no-slip grip with that silicone handle, and it has a very long, thin, rigid shank. And that's going to mean that I have to use reduced force, and I'm going to have less hand fatigue. It has advanced hardiness. So advanced treatments have been applied for strength and longevity. This instrument is resistant to wear, and it also has lasting sharpness. And I like to use it as my universal scaler, mostly posterior distal linguals and then lower anterior linguals. That's usually where I need to go after I do my ultrasonic, just to make sure there's no fine calculus left behind. I like this because it has the longer shank, and that's ideal for patients that have that long recession, especially in the maxillary linguals posterior, if somebody has like 6 or 7 millimeters of exposed recession, this instrument is ideal for fine scaling along those margins. Also, someone who may have some larger bulbous teeth, this is really great for getting around their margins. Added benefits of this instrument is that I have no hand fatigue. It's going to reduce my scale time because I know exactly where I'm going with this instrument. So my hand scaling has reduced, and I'm also going to have increased patient satisfaction. Acteon also came out with this Pure Reflect mouth mirror, and I wanted to show you how wonderful this mirror is. And I encourage you, when you go back to your operatories, when you're working, look at the mouth mirrors that you're using. The mouth mirror that I was using was a Value brand mirror, and I thought that this was okay. And then I received the Pure Reflect mirror from Acteon, and this is what it looked like. And I want you to see some differences in this mirror. When you look at the teeth in this mirror and the reflection, look how much brighter the Pure Reflect mirror is. There's a much richer true color that comes back in the reflection, and you can see how much more glare, how much more glare there is coming off of this. So after I'm done using hand instruments, I'm going to possibly use my air polisher. The air polisher that I prefer to use is Acteon's Air and Go, and this has 2 functions. It's a dual function supra and perio mode, and they make their Air and Go to have accurate and controlled spray. And it has a single handpiece that's ergonomically designed. It's very similar to the ultrasonic handpiece, and this has a 360 rotation. So when I'm using this handpiece, I'm easily able to rotate between the buccal, occlusal, and lingual surfaces. And again, I'm only using that light pen grasp. It has a clear view powder chamber, and it also attaches to my high-speed suction. It has 4 types of removable nozzles, and they're all autoclavable. So I want to show you these nozzles. So there's 4 types of nozzles, and the first nozzle is this supergingival nozzle, and that's for removing stain and biofilm. The other 3 nozzles are used for subgingival treatments, and the perio maintenance nozzle, that can be used everywhere in the mouth. But when we're talking about site-specific areas, somewhere where a patient may have implants, you want to use a perio nozzle, either the easy nozzle or the regular perio nozzle, and that's clinician preference, which one you want to use. One has more of a shoehorn shape, the other one is more like a perio probe. Acteon does have 2 types of powder. So there's 2 types of powders when using air polishing. There's a supergingival powder that's usually made out of sodium bicarbonate. Acteon offers theirs as a classic powder with sodium bicarbonate, and that's the most popular. And then there's also subgingival powder, and that's usually with glycine. And Acteon has this perio powder made with glycine. So for tonight's presentation, I reviewed understanding a prophylaxis appointment workflow, benefits of incorporating a prophylaxis technology workflow, applications for everyday use, and I made recommendations for improved patient and clinician comfort for a minimally invasive prophylaxis. And this is the sequence that I prefer to use when I'm incorporating my prophylaxis technology workflow. So I'd like to thank you for joining me tonight. And at this time, I'd like to answer any questions that you may have. The name of the intraoral camera, I have a question here. What is the name of the intraoral camera? And the camera that I use is Acteon's SoPro Care camera. My hygiene appointments. How long are your hygiene appointments scheduled for? I am scheduled for 60 minutes. Question came in, do you find a lot of offices do 45-minute prophylaxis? According to the survey that I did, no, a lot of offices did not do 45-minute prophylaxis, but I have worked in an office with a 45-minute prophylaxis, and this was all attainable during that time. Question, when do you write your notes? Is that in the 60 minutes? Yes, I always write my notes while the patient is in my room. I may start writing my notes while I'm waiting for my doctor to come in to do an exam, and then I finish them right before I walk the patient out. Question, are you finding that patients at offices are still concerned about aerosols? Yes, I think there are offices that are still concerned about aerosol. My office utilizes all the highest protocols. So we are still utilizing everything that was recommended by the CDC. Question is, do you scale interproximally? Yes, I'll scale interproximally. I was asked, how often do I perio chart? My perio charts are always up to date. I do full perio charting every year, and I always check at every appointment. Question is, what medications can you add to the piezo if needed? You can add hydrogen peroxide, chlorhexidine. You can also add iodine. I'm asked, do I ever use regular polishing cup or just air polishing? I use both. It's all dependent on how the patient presents. If the patient has more staining, then I'm going to use my air polisher. Question is, what process do I utilize to sharpen instruments? I prefer an Arkansas stone. Personally, I like to sharpen mine manually myself. I have an Arkansas and I also have a dual ceramic stone that I like to use. Question is, does the dentist do an exam in my operatory? Yes, he does. And for how long? I like to keep him on track for about 3 minutes. Question is, how effective is piezo at removing nicotine stains? I can remove all stains. I've never had an issue with my piezo. I prefer to use the H3 tip if I'm doing lower anterior lingual stains and also maxillary lingual stains. Question is coming in. I'm a new hygienist and the only one in my office. Is it better to sharpen instruments while the patient is in the chair, or should it be done at a different time? I do not like to sharpen with the patient in the chair, and that's because of the sound and also the time. I prefer to do mine prior to putting them into the into the autoclave. Question, does the dentist expect me to note suspicious areas decay prior to the exam? Yes, I will guide my dentist to where I think he should look, and I will also share that with the patient before the dentist walks into the room. I'll let them know that there's an area that I think the dentist needs to pay a little bit more attention to, since I can't diagnose caries. Is the mouth mirror anti-fog or not? Yes, it is. As long as you can clean it out right afterwards. Yes, it is an anti-fog mirror. Okay, so I'd like to thank Acteon for supporting this evening, and I thank all of you for joining.